Why are monoclonal antibodies used for lymphoma treatment? Imagine a highly trained team of guided missiles targeting only the enemy cells. Monoclonal antibodies act like these precision-guided weapons in lymphoma treatment. They are specially designed molecules made in laboratories to recognize and attach to specific proteins found on the surface of lymphoma cells. These proteins are called antigens, and different types of lymphoma have different antigens. For example, in many non-Hodgkin lymphomas, the target is a protein called CD20, which is present on B-cell lymphoma cells. When a monoclonal antibody like rituximab binds to CD20, it effectively marks these cancer cells for destruction by the immune system. This targeted approach allows the immune cells to identify and attack the lymphoma cells more efficiently, while sparing most healthy cells. Monoclonal antibodies can kill cancer cells through several mechanisms. They can directly signal the lymphoma cells to die, or they can recruit immune cells to destroy the marked cells in a process called antibody-dependent cellular cytotoxicity. Some antibodies also block signals that lymphoma cells need to grow and survive, effectively starving the cancer. Others are designed as antibody-drug conjugates, which means they deliver toxic drugs directly to the cancer cells, minimizing damage to normal tissue. For instance, brentuximab vedotin delivers chemotherapy directly to CD30-positive lymphoma cells, and ibritumumab tiaxetin delivers radiation to CD20-positive cells. One of the main advantages of monoclonal antibodies is their precision. Because they target specific proteins on lymphoma cells, they tend to cause fewer side effects than traditional chemotherapy, which can affect healthy, rapidly dividing cells throughout the body. This specificity allows doctors to combine monoclonal antibodies with chemotherapy, improving overall treatment effectiveness without significantly increasing toxicity. Before starting treatment, doctors often test the lymphoma cells to see which proteins they express. This helps determine which monoclonal antibody will be most effective for each patient. Different antibodies target different proteins, such as CD19, CD20, CD30, or CD52, allowing for personalized therapy tailored to the specific type of lymphoma. Recent advances include the development of bispecific antibodies, which can bind to different targets at once, boosting the immune response against lymphoma cells. There are also radioimmunotherapy options and antibody-drug conjugates, which deliver lethal agents directly to the cancer cells while limiting systemic exposure. In summary, monoclonal antibodies are used in lymphoma treatment because they provide a precise, immune-based way to identify and destroy cancer cells by targeting specific proteins on their surfaces. This targeted approach improves the effectiveness and safety of treatment, making monoclonal antibodies a key part of modern lymphoma therapy. If you or someone you know is considering treatment options, it's important to discuss with healthcare professionals to understand which therapies are most suitable based on the specific lymphoma type and overall health.